every day to his place of work.
If he had been following these guidelines, you wouldn't have been infecting others because of the social distancing, washing your hands, doing everything that we talked about. So we've talked about also how people make choices because of their jobs, that they have to come in. You'll notice I was not here over the weekend. I think this is the part that we really need to take personal responsibility for. Saturday, I had a little low-grade fever. So, actually, probably a GI thing. But, you know, I'm meticulous. I'm a physician. I looked it up. I ended up piggy banking from Walter Reed. So I got all kinds of things that we have to do for one another. This is the personal responsibility that I'm talking about, that we all have to practice.
When you say well, the cure to be worse than the problem itself. So are you saying that if we kept these measures that we're doing now in place for a couple of months
well, they will be in place. At some point we're going to open up our country, and it's going to be fairly soon.
Weeks or months?
I'm not looking at months, I can tell you right now. We're going to be opening up our country, and we're going to be watching certain areas, and we're going to be practicing everything that Deborah's referring to right here. I mean, we're going to be jobs. We have people get tremendous anxiety and depression, and you have suicides over things like this. When you have terrible economies, you have death. Definitely would be in far greater numbers than
You're listening to special coverage of the daily White House coronavirus briefing from NPR News.
And this is KCRW.
KCRW sponsors include Montecito Bank and Trust.
Carefully controlled clinical trial. So again, we need to someone to help us disentangle what he really meant by that, because again, it was contradictory.
And with respect to the malaria drug, it's called chloroquine, if I'm not mistaken, he has been very enthusiastic about its potential success to be a treatment for COVID-19. But there are concerns with moving too quickly with chloroquine, correct? There's already been a death from chloroquine reported, I understand?
Yeah, people do die from this drug. That does happen. And one of the major concerns, well, in addition to the fact that there's really very thin evidence that it's actually effective, is that people are hoarding the drug and buying it up in such quantities that people who actually need it to treat conditions like lupus are having trouble getting it. So yes, he's chloroquine used in combination with an antibiotic is an idea that is floating around and will be tested in New York City as it has been in other places and is being tested. But the president is counting on this Hail Mary pass to be successful, and we need to look at the odds of Hail Mary passes working.
All right, so while we're considering the president's Hail Mary passes, Sarah, I want to turn to you because the president was saying, this will be over soon, the economy will get a chance to spring back to life, but many states, according to your reporting, are actually increasing their restrictions on businesses and other activities, right?
Right, the president said just now that the country will be opening back up and this will be over very, very soon. But the trend is really the other direction. Several states are adding shelter-in-place orders or closing non-essential businesses. Just a couple of examples. Louisiana is under a stay-at-home order taking effect this evening, except for essential activities. That goes through mid-April. Virginia's Governor Ralph Northam just announced today that school will be canceled for the rest of the school year. So we are talking about months there of delay in normal activities, as well as a closure of non-essential businesses and a ban on gatherings of more than 10 people. We're seeing a lot of states take that approach, whether it's a shelter-in-place order or a cancellation of non-essential businesses, things like everything, but basically restaurant takeout and pharmacies and things like that. Many state governors have taken matters into their own hands after a lot of criticism of the president for not acting quickly enough. And it's really not up to President Trump, I think we should point out, when to reopen businesses. This is a call that governors have been making and will continue to make. And many of them don't seem anywhere close to reopening business soon at the direction of public health authorities.
And when it comes to medical supplies, as states are waiting for more federal help, both state and local officials have had to move aggressively to try to get more medical supplies for their state, for their counties, for their cities. Can you give us a sense of how our hospitals and health officials right now are dealing with it?
Right, we heard the president say that FEMA is working to get medical supplies out out to some of the most in-need areas. But this is another issue that we've heard a lot of criticism really from across the country from healthcare providers, that the administration didn't prepare enough, didn't act quickly enough. I've spoken personally to multiple ER doctors around the country and have heard stories about rationing masks for days or even a week at a time, reusing masks or preparing to potentially reuse them out of fear that there will not be enough over the long term. Definitely rationing supplies. We've heard this again and again, myself and other reporters from medical professionals. And
so the idea would be, and it's also a bottleneck in terms of collecting samples, because they can only do so many. So the idea would be that they've been exploring is maybe people can take their own nose swabs, just basically swab the inside of their nostrils, and package them up, and then just deliver those things packaged to someplace that can then take them off to a testing center. And that question that remains to be answered is that as successful and as reliable as doing the little deep throat swabs and the nose swabs? Both the president and the vice president complained that it was uncomfortable and so on, because they were really trying to make sure they got a very thorough swab of those areas. And if you're asked to do it yourself, you're clearly not going to be doing it to a point of discomfort.
Right. So samples might be inconsistent across individuals.
Right, and that's the biggest risk in terms of whether or not you get a positive or negative result. It's if you get they have documented people who were positive, the swab came back negative because they did the swab in the right place, or the virus hadn't quite matured or whatever. And so in that individual, it wasn't really expressing itself as abundantly as it might. So I think that will probably do a good job of catching people who are clearly there's a very high level of infection. But the question is, will you be catching everyone with that? And I think there has to be a trade-off there for convenience and ease and speed of testing versus the fact that you may miss some people if you use that approach.
I also want to ask you, Richard, this is something that's come up since the coronavirus outbreak started. President Trump has been making comparisons to the flu. Today, he talked again about how bad this year's flu season is, just as a point of comparison. Can you just fact check for us? Is that valid to compare the coronavirus outbreak with a flu season?
Well, flu seasons can send a lot of people to the hospital, and it can kill, and it often does kill tens of thousands of people in this country. However, you may notice that flu never overwhelms the hospital systems, right? The hospitals are geared to do that, to deal with those cases. For one thing, they're fairly spread out, and they also, it's part of what they expect to deal with. Here we're talking about a virus that's on top of that. So even though the numbers of deaths are much smaller than the flu deaths, it's really a misleading comparison. What the government is trying to do right now is trying to prevent hospitals from completely collapsing from the weight of having to treat so many people all at once. And so the comparison of the flu is misleading.
I want to return to something that you had mentioned earlier, Richard, but I kind of want to get maybe Franco to weigh in on this. There is this tension that the administration is dealing with between trying to put the country on steadier economic footing, but also dealing with a potentially escalating public health crisis. Here, I just want to play a bit of tape we heard earlier from President Trump.
We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. At the end of the 15-day period, we'll make a decision as to which way we want to go, where we want to go, the timing. And essentially, we're referring to the timing of the opening, essentially the opening of our country.
Franco, I guess, just politically speaking, what did you take from that specific piece of tape there, this balancing act that the president is trying to walk between bringing some relief to the country, saying, oh, the 15 days, once those are up, maybe we can relax a little bit, but also not wanting people to relax too much?
Yeah, he really needs to get this economy going. You mentioned politics. This is certainly a major concern of his. He needs the economy going. It was a major political point for him. It was part of his campaign. It has been part of his re-election campaign. But, the country needs to be safe.
All right, that is NPR's Franco Ordonez, Richard Harris, and Sarah McCammon. Thanks to all of you. You've been listening to special coverage of President Trump's press conference on the coronavirus from NPR News.
KCRW sponsors include Montecito Bank and Trust, committed to helping clients invest for retirement, provide for their family's future, or contribute to their communities. More at montecito.bank/wealth.
All right, this is KCRW. Support for NPR comes from the estate of Joan B. Kroc, whose bequest serves as an enduring investment in the future of public radio and seeks to help NPR produce programming that meets the highest standards of public service in journalism and cultural expression. And T. Rowe Price offering investment products and services supported by first-hand research to help investors reach their retirement goals. This is strategic investing since 1937. T. Rowe Price, where they say invest with confidence.
Support comes from UCI Health, committed to advancing healthcare through life-saving research, powered by the University of California, Irvine. Together, stopping at nothing to create healthier communities and better patient care. UCIhealth.org/stopatnothing.
All right, it is 4:19 here at KCRW. Thanks so much for joining us. My name is Larry Powell on this Monday afternoon for All Things Considered. We are waiting for Governor Gavin Newsom. He's scheduled to hold a press conference really any moment here. We'll have an update on the state's response to the coronavirus. When he does, we will bring it to you live right here on KCRW. Coming up on All Things Considered, Congress is working on a coronavirus stimulus package of about $2 trillion. Democrats say they are not slowing down the passage of that stimulus package, but Senate Majority Leader Mitch McConnell said otherwise yesterday. We're going to hear from the former chief economist for the Department of the Treasury with some of the ways lawmakers could get this massive piece of legislation. More than 100,000 people hit up his Instagram on Saturday night, so we'll talk more about that coming up on the program as well. Right now, let's check your roads. Diamond Bar 60 eastbound. This is before the 57. Got a car fire hanging out on the right shoulder that's got traffic stopped from about Lemon Avenue and slow from Pathfinder. In Fontana, 10 eastbound at Etowanda, overturned car blocking the off-ramp there. And in Riverside, 91 west at Central, there's a car fire blocking the off-ramp there as well. The weather tonight looking like partly cloudy, maybe mostly cloudy later on this evening with lows in the 40s and 50s. Partly cloudy tomorrow with highs in the upper 50s to mid-60s. Right now, 63 in Santa Monica.
From NPR News, this is All Things Considered. I'm Elsa Chang.
And I'm Ari Shapiro. Former Vice President Joe Biden spoke out today on the coronavirus epidemic and attacked the man he hopes to replace in the White House.
Donald Trump is not to blame for the coronavirus, but he does bear responsibility for our response. And I, along with every American, hope he steps up and starts to get this right.
The speech is part of Biden's new effort to get his message before voters and remain visible since campaign rallies are on hold for the foreseeable future. NPR political correspondent Asma Khalid is covering the campaign and joins us now. Hi, Asma.
Hi, Ari.
So Joe Biden here was not at a rally, but broadcasting from his home in...
Keeps referring to himself as a wartime president, and so if he is, he ought to start acting like one. And he specifically criticized the president's daily briefings.
So I hope today, in the days ahead, the president will give us the unvarnished truth. That's what the American people need and what they deserve. I hope he lets the medical experts and FEMA leaders and others carrying out the work to take center stage, to hear from them directly. And I hope we hear less talk and see more evidence of fast action.
And I should point out, he was also particularly frustrated today because it's the 10th anniversary of the Affordable Care Act, and he feels like the Trump administration has been trying to repeal it at this moment that we're in, which is a public health crisis.
Apart from criticizing President Trump, is Biden trying to show how he would handle this crisis if he were president?
He is, and some of his messages, I would say lately when he talks about the coronavirus, are about delivering specific policy ideas, but it's not just about content. To me, a lot of this is about style. He's trying to present this calm, compassionate voice compared to the more combative tone we've seen from President Trump. He's clearly trying to present this very reasoned sense of leadership. Today, he spoke specifically praising a number of governors, including some Republican governors of Ohio, Maryland, and Massachusetts. But he also pointed out that, Republicans and Democrats alike, they want more guidance from the federal government, and they're not getting it, which was also, again, a rebuke of President Trump.
Candidate, but the primaries are not over. Many have been delayed, and Vermont Senator Bernie Sanders is still running for the Democratic nomination against Biden. How does Sanders factor into this?
Well, Sanders has been doing his own live broadcasts for some time. His message during the pandemic has largely focused on the economic anxiety in the country. He's been calling for households to receive $2,000 a month throughout this pandemic. He says that it's not just a one-time cash payment that's going to be sufficient. Sanders has been questioned by reporters on Capitol Hill just about the general future of his campaign, given the fact that he has not won any recent states. And he seemed annoyed, saying at the time that he was dealing with a crisis, he didn't have time to deal with questions about the campaign. Yet last night, he essentially held a campaign event. He did a video live stream with members of the so-called squad in Congress, and that meant he actually missed a pretty key Senate vote to do this campaign event. I think the big distinction to me is that Biden has been largely emphasizing the public health concerns. Today, he seemed to also be elevating the financial concerns, including issues that have been personal to corporations.
Just in the few seconds we have left, many Americans are not thinking about the presidential campaign right now. They're focused on this disease. So what else might we expect from Biden as he tries to engage voters from afar?
Well, his campaign has turned his rec room of his house into a TV studio, and that's not just for speeches. He's going to be on ABC's The View tomorrow.
That is NPR's Asma Khalid covering the Biden campaign. Thank you very much.
You're welcome.
People with disabilities are asking the federal government to stop what they say are policies by states and hospitals that will ration care and deny them treatment for the coronavirus. NPR investigative correspondent Joseph Shapiro reports.
Washington State is one of the hardest hit by the pandemic. The State Department of Health issued guidelines to help doctors and hospitals decide something they fear, deciding who gets scarce, life-saving care. If there are, say, more people who need ventilators than the number of ventilators available, today, several disability groups filed a complaint with the Federal Department of Health and Human Services, asking the federal government to investigate Washington State's guidelines. The complaint says they tell doctors to give those ventilators and other care to younger and healthier people.
I'm really scared from the virus. Like, that's really terrifying. Because I was born with weak lungs.
Ivanova Smith, a woman with an intellectual disability, is one of the